when you reach the second trimester, what are the bodily changes or overall changes which you experience, the important things of the second trimester?
The moment you've crossed the first trimester, which is like 13 weeks, you've overcome the most challenging aspect of pregnancy. All the nausea, vomiting, and that you would have experienced in the first 3 months would now start reducing. Further into the second trimester, a bump will be visible. As a pregnant woman, your immune system is suppressed because we have accepted the fetus, which is essentially half foreign to your body. There is a condition called as pregnancy-induced hypertension. So it's a blood pressure raise because of the pregnancy.
Hello and namaste. This is Sonia Pava again from 9 and Beyond, your friend and guide. And I'm back here as promised with one more podcast to enlighten you, help you gain knowledge in your beautiful journey. And it is such a pleasure and honor once again, because once again we have Dr. Dipali Prabhat with us. And as she promised, she's taking us through trimesters. And today we shall cover second trimester of the pregnancy. But before I do that, for people who may be listening to this podcast for the first time, Dr. Dipali Prabhat is a very famous obstetrician and gynecologist from Mumbai with 25 years of experience behind her. And she has her own nursing home, her own practice with attached to various hospitals, has done enough research work in the field, is also, in my eyes, literally a life coach. And she really specializes with life science medicines, which she has done from the Life Science Medicines
American
College of Lifestyle Medicine. And besides that, part of her line though, but she also specializes with fertility, endoscope, sonography.
Yes.
So honestly, it's a huge honor that she pulls herself out of her very heavy schedules, comes here so that she can educate us, enlighten us, and take us through the journey trimester-wise, absolutely sharing all that is important for us. Thank you so much for being here, Dr. Dipali, and a warm welcome to you once again.
It's a pleasure.
And would you like to say something to them before we start?
I'm so glad you all are here and watching this podcast. And I hope all this information that we're going to share is going to be very helpful in this beautiful journey of your pregnancy.
Thank you, Dr. Dipali. And so now to all you pregnant partners and parents to be, and ones who are planning pregnancy, let's start discussing about the second trimester of this journey. And Dr. So when you reach the second trimester, what are the bodily changes or overall changes which you experience, the important things of the second trimester?
Yeah. So actually, I feel the moment you've crossed the first trimester, which is like 13 weeks, you've overcome the most challenging aspect of pregnancy. And now you're breezing into the one which is like the relatively more comfortable part of your pregnancy.
Wow.
So all the nausea, vomiting, and that you would have experienced in the first 3 months would now start reducing. So you will start feeling much better. So physically, of course, this is the time when you start gaining a little weight because now you're able to eat. So that will be evident that some kind of weight gain. So if you start physically from head to toe, I would say there's not going to be a lot of difference, but the beginnings of whatever changes happen during pregnancy will be evident as the second trimester starts. So the hair sometimes starts, there's a beautiful growth of hair in many patients. The face starts looking very radiant.
Yeah.
Okay, and sometimes there is little pigmentation, increased pigmentation, which can happen in some girls, some women over the cheek, which is called as melasma of pregnancy, which would start after the second trimester, and it will progress into the third trimester. Then hyperpigmentation over the body, so around the nipple, in the midline, you have a small pigmentation called as linea nigra in the midriff. Okay. And overall, sometimes there may be a little darkening of the skin, which is a part and parcel of pregnancy changes. As we progress further into the second trimester, a bump will be available, will be visible.
A little cute bump starts.
Yeah, because after the first trimester, now the uterus starts growing into the abdominal cavity. So, depending on how thin you are, the bump will be readily visible at that point of time.
Okay.
But that is the other thing. And physically, of course, because of the pressure of the growing uterus on certain blood vessels, there may be other changes like a slight swelling of the feet, or if there are already some varicose veins problem, that may become more prominent. So these are the physical changes which start in the second trimester. Of course, these are the objective ones. Subjectively, of course, the woman will start experiencing the movement of the baby. So something called as lightning, which starts around, say, 16, 17 weeks. If she is a second time mother, she would find, that familiar, and so she will know it earlier. But otherwise, for a first time pregnant woman, it will start around the 5th month, where she starts feeling the movement of the baby within her.
Right.
So these are the physical changes that happen. As far as the emotional changes are concerned, of course, once by this time the woman is kind of comfortable with that idea of now that she's pregnant, and she is kind of accepted it.
Right.
So she's finished through that phase of emotional appeal and all that. Now she's more in tune with the pregnancy. But the hormonal changes that happen because of the pregnancy, the raging hormone, that sometimes can make her go through some mood swings can happen.
Okay.
So I think in that phase, it's best to, kind of share all that feelings with a near dear one or with your doctor, and take care of it in case you experience it. I'm not saying everybody will experience it, because it's more of a happy feeling. So physically, you're more comfortable in the second trimester before all that, extra weight comes in the third trimester. So this is the best part of your pregnancy, where you can really enjoy the food that you're craving, and do a lot more, be a lot more physically active as well.
Okay. Yeah. And I do remember at this phase, like one thing is which is very prominent, despite little limitation you're talking about, is the glow.
Yeah.
Beautiful glow of happiness, which is generally there.
Yeah.
A little smile, there's a little nice feeling, which is very positive. Yeah. So, doctor, in terms of you're talking about pigmentation and skin, so is there any specific tips to take care of your skin and hair during this time?
Yeah. So,
and pigmentation.
Yeah. Yeah. So, skin, of course, is like, reflection of your inner health. So, I think the most important for good skin is what you are putting inside your body. Okay, in terms of the food that you're eating. So, I, as always, will always, ask you to follow a predominantly whole plant-based diet. That means include a lot of seasonal, local, organic vegetables and fruits, whole grains, lots of legumes and pulses, lots of good fat sources, which is very essential for a nice glow, is like having lots of nuts and seeds, and maybe a little bit of ghee also, which will, give you that kind of glow also.
Yeah.
And lots of water. These are two very important things for skin health. Okay. And of course, depending on where you live, depending on what the environmental temperature is, like, having, if you're sweaty, then, kind of have regular baths, and wear the clothes that are most comfortable for that. So those will, prevent you from having any extra skin irritations and infections. Because as a pregnant woman, your immune system is a little bit, suppressed, because you have accepted the fetus, which is essentially half foreign to your body. So if you take care of these environmental factors and improve your own immune health from within by, having a good diet, having good physical activity, good sleep, then that is going to play a lot bigger role in your skin and hair health. compared to what other things you can put from outside. Of course, those also are few things which I would recommend is whatever products you use for your hair or for your skin, try to see that there are no chemicals in them. Go for as
time also.
natural products as possible, and with least number of ingredients. Because typically when we see any product, there are like 8-10 things which we are not familiar with, and very typically they could be like lots of preservatives and chemicals. So try to avoid using too many products for your skin as well as for your hair, because somewhere it can get absorbed into the system. Some women may experience some hair loss, okay, because it also depends on what phase of the hair it is when you become pregnant. So don't worry about it, because it's a phase, so it will change, after pregnancy, if at all you experience it. The hyperpigmentation is also something which will go away. Okay. Also, there are, as your weight gets gained, there is stretching of the skin to accommodate the growing size of the body. So some stretch marks are going to be expected. We have preparations which will reduce the good moisturizing things, which are again water based, which will reduce the stretch marks. So those can be you can start applying them in the second trimester.
Okay.
As slowly the uterus starts becoming an abdominal organ.
So going to remember water-based stretch mark creams.
Yeah.
Right?
So that is good. And of course, I mean, you could use even plain coconut oil is also can be used. Yeah. I mean,
better.
Yeah.
Much better.
Yeah.
Right.
So we have so many natural things as well.
True.
So whatever your skin, feels nice with, you can use that, provided it doesn't have any chemicals.
Right. So talking about the importance of nutrition during this time, like you're giving them a wholesome diet, is there anything nutrient-specific needs of the growing fetus in the second trimester?
Yeah. So the first trimester, essentially, the pregnancy is very tiny. So we don't say you don't need to do a huge amount of changes as far as your diet is concerned, because you may not really gain much weight during first trimester. In fact, sometimes because of the nausea and vomiting, the women tend to lose weight as well. But second trimester onwards, now the baby is, all the organs and systems of the baby are growing.
Right.
So we definitely need a good amount of protein in the diet. So the protein content of the food has to increase in the second trimester. So also certain micronutrients are required. Okay, so we typically start on supplementation only in the second trimester, like iron, calcium, and vitamin D, and maybe some micronutrients. But I would always prefer that you get most of it from your diet. So if you have a diet which is well balanced, which is protein rich, and has all colors of the rainbow, which will give you the different antioxidants that nature has provided you, and also the minerals. And so eating a good variety and eating according to the seasons is the most beneficial, and that will take care of the extra requirements. So calories wise, we know pregnancy, you just require 300 calories extra from the baseline. And so you really don't have to eat for two, but just see that you include more protein rich foods. And typical vegetarian sources are all your dals, all the sprouts,
right,
and the green leafy vegetables, which are very high in protein. You can incorporate some amount of animal based products like yogurt, and depending on how, or lean meats and fish can be taken a few days of the week, to increase the protein content of the food.
Perfect. So, and I remember the importance of iron, which you told them last time, how important it is during this time.
Yes.
Yeah. Okay. So, doctor, now that, you were talking about weight gain, and sometimes people can get scared, like, with so much pressure also of the family members, ye khao, wo khao, the weight gain. What is the range of weight gain which should be acceptable during the second trimester? Just as a guideline, so that they know, okay, this much weight gain is good for them.
Yeah. So actually, the weight gain typically, if you calculate throughout pregnancy, depends a lot on what the pre-pregnancy weight is.
Okay.
Also, okay. So if the pre-pregnancy weight is high, so if the body mass index is more, like say around above 28 to 30, 32, then we don't want a lot of weight gain. So then we are also all right with 5 to 6 kgs weight gain
In the total
in the whole pregnancy.
Okay.
Suppose the pre-pregnancy weight is normal, say between BMI is between 23 to 25, like
Okay.
your average weight, then we can expect a weight gain of 10 to 12 kgs during the pregnancy. So
Okay.
say starting from the second trimester, about 1.5 to 2 kgs per month
Okay.
is what we are looking at. Okay, but if your weight is more, you could gain even lesser. As far as the baby is growing well,
Okay.
which we monitor clinically as well as by doing serial sonographies, we are happy with that as long as you have a very healthy weight gain. We don't want, like, the gain of weight in terms of fat gain, which is very, very difficult to shed off also after the pregnancies, you
It
deliver.
can create complications.
Exactly.
irritability
And in
stuff.
certain
So,
cases,
yeah.
in fact, where if there is a lot of too much overweight and you become prone to certain extra complications in pregnancy, we would like strictly control the weight gain as well. Not, I would not propagate a weight loss during pregnancy, but like really monitor, where we are really monitoring the diet very well to the minute detail, where we are monitoring the sugars and things like that. And so it just depends on at what point you start your journey with.
Okay. So by and large, you can say a person who is by and large slim
Average, yeah.
can gain up to 7 to
Up to normal weight would be around 10 to 12 kgs throughout
Okay.
pregnancy.
Okay.
Overweight person 5 to 6
7.
6 kgs.
Right.
That is
Okay. That's a good
enough.
guideline.
Good enough,
guideline.
yes.
Okay. So taking all this into consideration and knowing the importance of exercise and physical activity.
Yeah.
Now that you have settled down into your pregnancy,
Yes.
we understand it's very important. So how would you specify like the kind of exercises, the precautions, what's good for them, what's not good for them? Yeah.
So generally, if a woman has been physically active and is following some sort of an exercise regime pre-pregnancy,
Okay.
we don't particularly ask them to stop that regimen during the first 3 months of pregnancy, provided there are no complications as such, that she's not experiencing like a threatened miscarriage or anything of that sort. So physical activity, in fact, is very, very beneficial for the pregnancy as well. So that can be continued. But for women who have not really exercised before the pregnancy, then we don't ask them to start any new exercise during the first 3 months. So second trimester is the time by which we've done our basic ultrasonography. We know, you've cleared out all the contraindications, and we know symptomatically also the patient doesn't have any things which are going to be against exercise. Then second trimester is a good time to start with some sort of an exercise routine. Okay, and it should include a mix of everything. So something light cardio, which is like making your heart beat a little faster, which is like your brisk walking. Or don't start with brisk walking. If you're not walking, start with just walking.
Okay.
Start for a few minutes and then slowly build up on it. Then if you're already in an exercise program, you can continue with that program. But you have to be mindful that now you're pregnant. So you need to have good hydration. Also, the exercise is going to generate heat in the body. So you have to take good pauses and allow the temperature to go back to normal. So I think the best thing is to listen to your body, to do, what intensity, what you can do, and, kind of stop at that. Of course, I always propagate yoga because, it is the best, there's no high impact. You're doing those flexible movements, according to your own capacity.
Right.
And we have such beautiful scriptures which are telling us which asanas to follow in which trimester. I feel that's a wonderful thing to do. So as a on a daily basis, I think you should practice yoga, you should do breathing exercises, you should do meditations, and whenever rest of the time walking is good, or any other kind of a light cardio where in which there is no contact, there is no high impact, that those kind of exercises. Swimming is a great exercise if you're sure about the hygiene and stuff like that. Then anything underwater is very low impact. So, those exercises are wonderful to do during pregnancy, especially starting in the second trimester.
Okay.
And then building it up.
Any kind of exercise which they should not be doing at all? Anything specific?
So any kind of contact exercise where, you're likely to collide into people or collide into things, or anything which is going to have high impact on the body, on any of the joints. Typical sports and things are not something which we would advocate.
True.
Yeah. And of course, there may be certain medical contraindications also to exercise. Like, if there is a low-lying placenta, if there is a evidence of premature contractions of the uterus where, you are worried about a threatened miscarriage, then those are the few contraindications which, we have to take care of. So I think before starting any exercise program, it's good to consult with your doctor. And kind of
have a training into it, like have somebody give you the exercise
supervision. Initially it should be always under some kind of supervision.
While we were talking about the exercise, doctor, is there any, like we said, certain things not to be done, any special exercise which you will highly recommend to prepare the woman for the coming days?
So one exercise which this is to prepare for a normal vaginal delivery and also to prevent damage to the organs which are around the uterus is Kegel's exercise.
Okay.
So these are basically pelvic muscle exercises. So basically the uterus lies nestled between the muscles of the pelvis. Okay. So kind of the muscles go crisscross and the uterus is sitting on top of it.
Okay.
These exercises these muscles are never exercised on a normal routine basis. Okay. So after the third month, we ask the woman to do these exercises. Specifically, the way to do it is to contract the vaginal muscles as if you're holding the stream of urine, as if you're stopping it. So just to know which muscle to contract, you try to do it that time. But otherwise, these exercises are to be done when you're not, like you could do it when you're watching television or cooking or whatever. So you just contract the muscles, hold for some time and relax. Okay. So that will make the muscles very supple. Okay. And these are the muscles which are going to expand and stretch out at the time of delivery. So if they are nice, soft and supple, then there will be least amount of damage to the muscles. So that is one exercise which I would recommend to start after the third month and continue it throughout till the time of delivery.
Do it as often as possible?
So we generally say start 5 times contractions 3 times a day, and then we'll return to up to 50 contractions also 3 times.
Perfect. And, taking care of their body, their exercise regime and everything, doctor. This is the time when there can be few discomforts. So how do you look into, what are the kind of discomforts which they can feel and how do they take care of that?
Yeah. So as I already said, second trimester actually is the nicest part of the entire pregnancy where for some women, she may not really have any discomfort. Exactly. But of course, there are certain changes which are happening in the body to accommodate the pregnancy, like there is relaxation of the smooth muscles. So that's not just limited to the reproductive organs. It also affects the digestive system. Okay. So you can have reflux of food. Basically the time for which the food passes through the intestine slows down. Mm-hmm. So the stomach empties also slower. So there is a chance that the food can go back into the food pipe and patients may experience acidity, heartburn. So that is one thing which can happen for some women. Then because the blood supply to all the organs is now increasing, so you may experience nasal congestion. Okay, so sometimes you feel more, you feel the nose is blocked. Actually, you're not suffering from a cold, but it's just that the entire inner linings of the organs are more vascular, and that can give rise to that feeling of nasal congestion.
Okay.
Then, of course, with the expanding uterus, it kind of occupies some extra portion in the abdominal cavity. It can have pressure on the intestines and all that. And as I told you, so the chances of constipation are more during pregnancy if you're not very mindful of having, enough fiber in the diet. And so you can have certain aches and pains in the body because of gas and things like that. Also, certain urinary leakage sometimes, occasionally, because again, all the smooth muscles are more relaxed. So sometimes suddenly your bladder is full and you suddenly laugh. You may feel you have, leaked a little bit of urine. So this kind of incontinence issues. So these can all start around the second trimester, and these are essentially many things are explained by the normal physiological changes that happen in the different organ systems.
Yeah.
So you just need to be mindful of that and not like start worrying about it.
Yeah.
Sometimes there may be some secretions from the breast which can start towards the end of the second trimester. So it's basically all these preparatory things which are happening, which a woman may feel uncomfortable with.
True.
And as I already said, there may be swelling of the feet, there may be increased varicosities. All these are slow pressure symptoms which start with the enlarging uterus.
Okay.
So these are the common discomforts that can happen where you're not expecting anything abnormal. But of course, if you are experiencing swelling of the other than the feet, like fingers, face, things like that, then of course we have to check for other
It's like a red
like
flag.
a red
I was just going to ask you that these are the discomforts which are acceptable
yeah,
and which we do not worry about.
correct.
Part of every pregnancy, yes. But what could be the red flags? Which level of discomfort should be reported for immediate medical attention? I think it's very important to understand.
Correct.
Yeah.
So typically, as we progress through the pregnancy, there are certain tests that we keep on doing, as the pregnancy progresses. So we monitor the blood pressure of the woman at every visit. Okay. So there is a condition called as pregnancy-induced hypertension. Okay. So it's a blood pressure raise because of the pregnancy. And typically it is because of the resistance that increases in the placenta, which is the nourishing organ for the baby. So those blood vessels, if they get narrowed down, then that reflects as a increased blood pressure. And objectively, what it could reflect as a slightly more weight gain than expected during the between visits. I explained to you about 1.5 to 2 kgs is normal, but suddenly you have 4-5 kg weight gain.
Right.
That's a red flag because that may be because of water accumulation. So it can be evident as swelling of the feet, sometimes swelling of the fingers, swelling of the face. So we have to be very vigilant whether is this woman developing pregnancy-induced hypertension. That is one thing that we are vigilant about. Second thing is gestational diabetes. So we always screen for diabetes that may become apparent because of the pregnancy, because of the load of pregnancy on the system. So that is another thing which we screen for in the second trimester. So around 24 weeks, we do that test. So these are two things which are very relatively more common in normal pregnancies. We are not really talking about medical conditions which are pre-existing before pregnancy because we are knowledgeable about that.
Absolutely.
And then we would accordingly, have another consultant in loop to manage those conditions. These are two conditions which may arise de novo in the current pregnancy. So as far as the baby is concerned, of course, we do the sonography in the 5th month. And there may be certain conditions which are related to the baby, which could be red flags. And then we have to monitor that aspect as well.
True.
So these would be the two common ones that we would think of in terms of red flags. Apart from, of course, certain subjective symptoms that the woman may experience, like, if she feels some contractions, then we have to things in terms of if there is any premature labor or things like that. Those will be depending on what the woman herself experiences. Yeah.
Doctor, since you're talking about all this, my mind is going to one thing which, talking to you over the podcast and to other doctors and experts on the panel, every time it has come to the fact of emotional well-being.
Yeah.
So I'm suddenly feeling that it's really important, right, to take care of your emotional well-being, because these are the things which are contributing towards sometimes. The medical reasons could be different.
Yes.
Keeping those aside.
Yeah.
But mostly they see the emotional well-being plays such a huge role.
It does, because basically what we mean by emotional well-being is what is the kind of resilience that you have developed to face situations in the outside world. It's that making yourself strong so that you don't react to situations but respond. Because that is directly proportional, because our brain is still primitive. When it reacts, it creates the stress hormone, which is cortisol. Right. Okay, and cortisol is going to kind of contract all the blood vessels. Yeah. Okay, so that is going to happen to the placenta as well. So there is, beyond every physical explanation that we have, there is also an emotional connect to any kind of disease that you experience. So if you're able to, maintain a good emotional health throughout pregnancy, it is really going to be very, very beneficial to us. So I think it's very important to address that as well.
Bilkul.
And emotional health main thing is the awareness.
Yeah.
And also the thing that there are people around you, to help you, to share things with you. You don't need to keep things to yourself. Whatever it is, whenever you suppress your feelings or suppose that is going to cause more harm to you. So it's like, you express it, you kind of find solutions to what problems you're facing rather than worrying about them. That is the approach I would ask. And
the problems may be there. Nobody's denying them.
Absolutely.
But we have to take charge of those problems. This is the time to learn to take charge.
Exactly.
As you added responsibility towards the coming child.
Exactly. So it's not that, everything is not the same. You physically you're changing, emotionally you're changing. You don't have to think that, no, I'm going to do everything myself. You don't have to be a superwoman. You can delegate few things here and there. Make your own priority list and kind of decide, okay, this is more important at this point of time. The other things we can. Yeah. So we are actually creatures of habit. And then when we get overburdened, then we get flustered. What can we do? So we have to realize certain habits are meant to be changed.
Yeah.
And sometimes pregnancy is an opportunity for us to, adapt very good habits, which may, really benefit to you, may be beneficial throughout your life.
Yeah. And it's like a mother to be is so focused towards her child. That feeling is such that what you've never done for yourself, you will do it now for your child.
Exactly. So I always
it's the biggest motivation.
Absolutely.
And for the partners, the responsibility is increasing. Learn to share it. Put in more effort, right, doctor?
Correct.
In the second trimester, when you say delegate. Yeah. I think the partner's responsibility by the day starts increasing.
Absolutely.
And the contribution has to
Absolutely. Like when we talk about physical activity, when we talk about changing in the diet, it's the entire family that has to kind of be supportive. And I'm sure if they really follow the diet properly, the entire health of the entire family will improve.
Actually, it's a fact.
Yeah.
True. Yeah.
So, she is the motivator, but, people will start bringing in more fresh fruits, more vegetables. They will see to it that you're eating a more balanced diet, more proteins in the diet,
share more work, become a better human being.
Exactly. The spouse can really contribute, to helping you out with, it may be small things, but, that gives that sense of relief to the woman. Few things like shopping has been done or, few things are already in place. Like she doesn't have to look at every small thing in the house.
You take care of the physical needs and somewhere the emotional needs get satisfied.
Yes, also.
I think it plays a very big role when the physical needs are taken care of. Emotionally also, it gives a beautiful feeling.
Yeah.
So coming to the baby, doctor, now that we've taken care of the woman, her body, her mind, her nutrition, her weight, let's come to the baby now. So for the developing baby and the fetus.
Yeah.
What are the parts which are developing in the second trimester?
Yeah.
So what is the importance should be given towards the needs of the growing fetus now?
Yeah. So by the end of the first trimester, structurally every organ is in place. Okay, so the beginning of the growth is already there. Like as I mentioned in the last podcast, the sex organs also have been finalized around the 10th week. Okay. Now this is a part where each organ is getting more and more specialized, and the structural defined structure is getting formed. Till the baby is ready to be born. So for us, one important test that we do in the second trimester is the malformation scan or the congenital anomaly scan, which is done on somewhere between the 18th and the 20th week.
Okay.
And that is the time when the sonologist will look at the baby from head to toe in very much detail, whether the entire, how the brain looks, the face, the bones, the heart, the lungs, the liver, the kidneys, the intestines, the skin, the hands, feet, toes. Everything is scanned in detail to detect if at all there are any kind of abnormalities. So that is how slowly by that time the development is almost that complete. So it's like, it's a mini human being which is already formed by the 5th month. And then, of course, it's about the maturity of the organs. And sometimes if there is any kind of problem in the heart suspected, then we also do a fetal 2D echocardiography, which is done around the 6th month. If there is any suspicion of, those kind of changes. And once the structural, anatomical structures are developed, then slowly the functional part of it also starts. So essentially the fluid which is around the baby, which is the amniotic fluid, is basically a large part of it is fetal urine. So the baby is getting all the nutrients from the mother through the placenta, through the umbilical cord. It is utilizing them, and then it is excreting the urine, which becomes the fluid around which it is floating. So a lot of certain tests we do by tapping into the amniotic fluid. We can get information about the baby's health by looking at that as well. So that is how the baby develops. And then if there are any issues which are, being there with the baby, is the time when we decide whether these issues can be dealt with. That means, are they compatible with life and a good, healthy baby?
Okay.
If they are not, then that is the kind of the last time where we have a chance, if at all you want to not go ahead with the pregnancy. But otherwise, that's how we monitor the baby. And the senses wise, of course, the baby has already started moving. By 6th month, the hearing organ also starts developing. So the baby can actually listen to what the woman is saying, the environment around her. And that's where, all our chanting and storytelling and music is going to help and affect the baby's emotional health as well. Just as we absorb things from our environment, the baby is also going to absorb things. Then slowly the sense of light also will be, developed. So the baby will be able to kind of feel light after the 6th, 7th month. And then the movement. So when you touch the abdomen, so all these different senses, the sense of touch, all these are going to progressively come into the picture. Then the sense of taste, even that, because the baby is swallowing things. So whatever the baby can react to it. Wow. So all these things can happen. So much, the baby and the mother are connected with each other.
That means from the fetal development point of view, this is the second trimester is of really great importance.
Forms the foundation,
right?
Yes.
Considering that, then even test-wise, one cannot be careless about it.
Yes.
Because it's so important.
Very important.
That the physical developments are good.
Yeah.
Considering that the emotional developments are also happening at the senses.
Yeah.
This is the time where the atmosphere around, the behavior, everything has to be in sync so that you have a a good baby, right? If you want a good child, you have to be good yourself.
Absolutely.
So from that point of view, this time seems to be a very, very important
Very
time.
important. Very important.
Which means that are there any more specific tests which should not be ignored, which must be done at this time, considering the importance of this thing?
Yeah. So most of the initial tests are over by the time you do the first trimester. You do the early anomaly scan and the entire antenatal profile, and also the risk screening for chromosomes. Suppose a woman has missed that, she's not been able to do that, then the second trimester is a good time to do those tests for the first time if the woman has not, been able to access a doctor there. And we also have a chromosomal screen, which can be done along with the malformation scan, which is called as the quadruple screen. So it's a blood test where it evaluates the risk of any common chromosomal abnormalities in the baby.
Okay.
So that is can be done in the 5th month itself. And then, of course, it's the diabetes screening test, which is done in the 6th month, which we do routinely for all the patients.
Okay.
So these are the tests which are done.
Okay.
In terms of other things that we do, we also start vaccinating the woman in the second trimester. So we will start vaccination against neonatal tetanus, so the typical tetanus toxoid or a diphtheria tetanus combination vaccine. We would give the first dose after 16 weeks, that is after the 4th month. Okay. First dose followed by another dose after about 6 weeks' time. In case you are pregnant in the flu season, which is from April to November, then we also advocate a flu vaccine, which can be again given in the second trimester onwards. So these are 2 other things that we give. And apart from it, I had mentioned that we also start the supplements of iron, calcium, vitamin D. And these are essentially, of course, if you have an extremely well-balanced diet and you're good nutritionally, these supplements are more for the replenishing whatever has been taken away from the woman rather than for the baby itself.
Right.
Because this is the time when she's motivated to take some kind of supplements. That's the reason we give them. So that whatever the baby is going to take whatever it needs from the mother. So unless the mother's stores are extremely low, the baby is not going to be affected. Okay, so that's the way, we look at it. Of course, if there are deficiencies, we have to treat them. Like anemia is a problem which can happen with like a poor, diet and all that. So in all those things we have to take care of. Okay. During the second trimester is a time where we can do a lot of groundwork before we, embark on that journey of
which can
delivery.
also help you rectify if whatever.
Absolutely.
And
So
save
this is a good
whatever.
3 months time where even if a patient requires like a dental procedure or sometimes any surgery, it is all to be done in the second trimester.
That's lovely. So now that we've taken care of the mother, the growing fetus, in the sense that I think we've covered pretty good points today on the second trimester. Let's give them something nice and lighthearted about what about their travel plans and the lifestyle changes which they can adapt, what is safe for them, what is not safe for them.
So traveling wise, again, this is a good time to travel because first 3 months generally we kind of, always tell the patient we are not very sure about everything. Try to avoid journeys which are not absolutely, very crucial. So second trimester is the time when you are feeling better, you're eating well, you are more active, and yes, you can travel definitely. Only thing I would avoid is avoid a lot of bumpy road travel. Trains are good, or traveling on good roads is fine. Air travel is fine too. Most airlines don't ask for any certification before the beginning of the 3rd trimester. So this is a good time to travel. Take a good vacation, connect with your partner, you can enjoy definitely.
Okay.
One thing about traveling is about the food. So try to avoid taking a lot of convenient and packaged foods and also eating out at, places which may not be typically giving, hygienic kind of things. So always try to carry your food stuff At least the pregnant woman should be carrying her homemade food and, maybe some dry stuff also, which is homemade and made in a very nice way. So those are certain tips that I like to give for travel.
Yeah.
And try to take breaks in the travel. Don't be sitting in the car for too long. You have to move your legs. You have to, the stiffness can come sooner.
Right.
So take enough breaks for movement. Take enough breaks for emptying the bladder. Don't keep the urine retained for a long time.
Right.
So I think if you take care of these few things, then it's a perfectly fine time of your pregnancy to travel.
Perfect. Yeah. And these are very good tips like for travel. Yeah. Like that. And what about the lifestyle adaptation? Something which you would recommend during this time?
So lifestyle again is all about your nutritional changes, exercises, taking care that you're, sleeping on time. Okay. And get that good 8 hours sleep. Stay away from all kind of toxic substances avoid any kind of exposure also to smoke, secondhand smoke. Of course, alcohol is a no-no during pregnancy. And try to be happy, be with people you love, enjoy with your friends, try to keep your mental state in a positive thought pattern. Okay, don't get too many things which worry you down. If you feel worried about a thing, you please share with your doctor. You find out whether is it a real worry or is it something imaginative. Because many women can go into that phase of imaginative things, which is never going to happen really, and unnecessarily they stress themselves out.
Yeah.
So I think it's always good to, find out whether your worry is real or it's unreal.
Yeah.
So I think that is the...
Yeah, all this sometimes extra knowledge around us can give us some unnecessary worries, which should be clarified.
Yeah,
that's
and try to be comfortable in terms of what you wear, in terms of your footwear, everything. Just give the priority to comfort.
Yeah.
Above everything else.
Perfect. So now that so it's lovely, so but any advisory concerns you would like to sum up with specifically?
So in the second trimester, as I said, what things that we can detect is development of pregnancy-induced hypertension. I mentioned a bit. So the blood pressure will be monitored. And if it is high, then certain dietary changes would be advised. Some certain medications may be needed to start to take care of the blood pressure during pregnancy. If the woman develops a gestational diabetes, again, it's the same thing. Always initially, it is a dietary modification. And if required, oral medication or insulin may be needed to be started during the second trimester or third trimester, depending on, when it develops. These are things. Certain conditions get diagnosed when we do the ultrasonography in the second trimester or when we do an interval scan at the end of the second trimester, where we may need to do some interventions. Also, as far as the baby is concerned, also if there are any things which are detected within the baby, which need to be monitored, all these things are, things which are ongoing, may be diagnosed during the pregnancy. Of course, this is apart from the pre-pregnancy conditions which the woman has. For all those conditions, the progress has to be monitored. Many of the medications may need to be changed. Like there are certain medications which are all right in the first trimester, we have to change it in the second trimester. Those are typical individual conditions, like there is epilepsy or if there is tuberculosis or whatever medical condition if the woman has, then in conjunction with that particular specialist, obstetricians will work in close connect and monitor those conditions. Like if the patient has hypothyroidism or everything, then all the dosages will need adjustment. So all those things have to be. So that is why our visits are important. Like once we have kind of categorize the woman into whether, she's high risk or low risk, which kind of we do it by the end of the first trimester.
Right.
We have identified basic risk patterns. And then, of course, certain risks can develop over the time of pregnancy, and then we have to recategorize. So, depending on that, we may need to call the woman more often.
True.
But otherwise, generally, we have visits once in a month in which we can, address, see how the weight is being gained, whether the blood pressure is normal, whether the baby is growing well. All those things are taken care of. So all the red flags which come up, we have to be alert. So I would say, the woman, you just do what you have to do. Leave the rest to the doctors. They will take care of everything else. As long as you, do what you need to do. In fact, you may not get into any other problems, because
Perfect.
so many things are related to, your good physical health, good emotional health, and the daily routines that you set up,
True.
because each of it contributes to your health.
Absolutely. That's an amazing advice you're giving. Actually, you really summed it up in a beautiful, you've actually given instructions in the end. Ye karo, aise karo, everything else will be good. And leave it to, doctors like so. So again, I said, one of the things which I'm really picking up is again and again, you repeat it, is communication. If there is something, share it, speak up. Don't hold on to anything. It's very important for the fetal health as well as a mother's health, right? So, and of course, whatever you said just now, give the final advice, doctor.
So, ladies, please go and enjoy in your second trimester. Is the best time of the pregnancy.
Right.
So, fundamentals have to be in place. So, a good diet, good regular physical activity, good sound sleep, okay, and staying away from all those things that are going to harm. Maybe it a beauty product or things, which are full of chemicals. Stay away from those things. Connect with people. Try to stay happy. Don't forget your doctor's appointments. Don't forget all your routine checkups and your blood tests, and you will do well.
Absolutely. Thank you so much, doctor. I think today's session, you really covered it well, and everything there laid out for them for a very smooth, happy journey. And we try to make things as easy as possible for you all. So wishing you all beautiful, safe, simple times where you're enjoying the pregnancy, keeping yourself safe and healthy. Please take care of your nutrition, take care of your physical activity, enjoy what you're eating, doing, be happy, be healthy, and we'll see you again very soon with the third trimester details from Dr. Dipali. Thank you so much, Dr. Dipali, for being here. And thank you so much, audience. Take care and God bless. And if you have any questions, any queries, please feel free to ask. Always there to help you all. Thank you so much.
Thank you.